So my name is Dr. Victor Okello. I work for the U.S. Center for Disease Control, supporting the Ministry of Health and the other government in COVID response. So I just want to share with you briefly about what COVID is and some of the things management of COVID situation. So COVID-19 is a viral disease that came out in late last year, and the first case was detected in China, in a city that is called Wuhan, and then later on it spread, of course, as we know, in the different other countries. In Kenya here, the first COVID case was reported on 12th of March 2020 this year. As at now, as we speak, there's over 20 million people that have been affected with COVID-19 virus victims, and out of those over 20 million, slightly over 20, about 700 and over 740,000 people have died of COVID globally in the whole country, in the whole world. And there is several, close to more than 50% that have recovered from COVID-19. So definitely COVID-19, the first message is that it's not a killer. Not everyone that has COVID has to really die. So we don't have to stigmatize that. In Kenya, the total number of cases that have been reported as we speak is slightly over 28,000. Today's cases, if you had, we are going to hit over 29,000. And out of these, about over 430 something thousands have died. One of the things that I would like to let you know is that COVID is spread through two main mechanisms. One of them is through what we call droplets. When you sneeze or when you cough, there are those small particles that you produce, and those small particles contains the virus if you are infected. The second, and if someone is close to you, then they can land on your face, they can land on your nose, so you can breathe them in if they are around the air that you breathe. The second one is what we call surface contaminant. Surface contaminant means if someone coughs or sneezes and it lands on a surface, then that surface is infected. So it requires, if you touch that surface and then touch your face using that hand that you have touched the surface before you wash your hand, then you end up with that infection. There's a third source of transmission, which is not very common. It's mostly found in hospital setting, and this one is where we call it aerosol producing. So aerosol producing is simply because there is very small, minute particles of the virus that when there's some procedures that are done in the hospitals, like when you're trying to put a pipe to help someone breathe, we call that intubation, then they can produce the virus. And when they produce that virus, they can produce very small pieces of it. And those ones, the issue with that particular infection is that those can linger in the air for several hours. If you don't want to acquire it by someone droplets, then you put on face mask. So that is the genesis of the face mask. The face mask is able to prevent you from acquiring COVID from someone that is infected. So we encourage that everyone in public put on face mask. And as you would see, I'm actually talking while I have my face mask on, which is something that I think people often don't do, that they remove their face mask when they want to talk. But ideally speaking, is one of those mechanisms that produces viral particles. So you need to have your face mask on and try to learn to speak inside your face mask. The second one, of course, is social distancing that has been found. But more importantly is people need to be washing their hands. You need to wash your hand frequently every time you touch any place, every time that you are coming from inside or outside. You need to wash your hand for at least 20 seconds to be able to prevent COVID. How is COVID managed? Most of the time, what is known is that majority of the people that end up with more infection is that you can actually end up with many people infected. But close to over 80% of those people don't actually show any symptoms. That leaves around 20%. In Kenya, it's actually higher. We have seen as high as 90% of not showing any symptoms when they have COVID, which means these people have the virus, they can transmit it, they can be walking, it can't just be anyone next to you, standing next to you, that has COVID, and in talking, in speaking, in coughing, it can pass that virus, or if it touches a surface and contaminate it and you touch that place back, you can get infected.
Thank you so much, Dr. Victor, for that presentation. That is very informative to our members. Maybe the first question I would like to ask you is, we are hearing coronavirus. What does coronavirus really mean? Because when you see some records, you see the other coronavirus, like coronavirus has always been there. So I think some people are asking, if you see some containers, they say this one kills coronavirus. So does it mean coronavirus has always been around? And what exactly is this virus?
Coronavirus, you're right. We have had coronavirus before. We have had, if you have heard the name of this particular coronavirus, you will hear SARS-CoV-2, which means the number 2. The first thing you hear SARS, which means there have been severe acute respiratory syndrome. There have been previous other similar coronaviruses that have caused the diseases. Early back in 2002, there was an outbreak that was caused by corona. In the early years, there are also several outbreaks that have been caused by corona. We have also heard of this one that is called Middle East respiratory syndrome. It's usually called MERS, M-E-R-S. That's also another type of coronavirus. We have always had coronavirus, but this particular one is unique. We call it novel. Novel means that it has a unique characteristics, and it's more infectious as compared to the previous coronaviruses that we have seen before, and it spread much more. And there's been no knowledge about this coronavirus before the outbreak that happened in China. The biggest concern for this particular coronavirus is the spread of this, the widespread, how much it spread, and of course that the fact that it causes a significant amount of death. Yes, we talk about 5% of the total population dying, but that 5% can increasingly become too many people if you have a population, say, of 1 million. So we need to ensure that we prevent any death from occurring. So that's what I would say about this particular coronavirus. And just like any other viruses are relatively weak generally. Viruses can be killed by very simple things like just use of alcohol. And that is why you use this thing called sanitizer. Sanitizer has 2 types of alcohol. It has an alcohol that is at least 60%. That's usually called ethanol for if those who are in school. And then it has another one that's called isopropanol. So that's at 70%. So you will always hear this comment that you need to ensure that you use an alcohol that is 60 to 70%. To ensure that it kills this particular virus. But the basic thing, like just use of soap and water, because it has a protein that is just degenerated by use of soap. So soap and water and use of cleaning your hand as frequently as possible, you will ensure that you'll get rid of it. And we are talking about ant, because ant is the most common place the most common one that you'll touch in other places.
If you drink alcohol, can it also cure the virus?
Yeah, we have actually had these questions, and I think there have been some people that have talked about alcohol. At least I know the percentages. The alcohol percentages that we usually have is about 5%. Sometimes it goes up to 10. But the most strong one is, I think it's usually spirit. I might be if I'm right, and that's about 40%. So it means that even if you use that alcohol on the surface itself, then you are still not able to kill the virus just using that 40%. You need as high as 60%. And most of the time, use of 60%, people drinking 60% is almost killing yourself. So it will mostly cause a lot of damage in your own system if you try to take that highly concentrated people. In fact, there actually a paper that came out yesterday in the US that showed a number of people that have died because they took sanitizer. Please, don't try to drink sanitizer. Don't try to drink extremely concentrated alcohol to try to prevent this. The alcohol is supposed to be used on the outer surface because at least you have a layer that protects you from it being absorbed.
What exactly is the difference between the coronavirus and the common cold that people usually have?
The common cold is usually very mild. It's rare to find someone really admitted unless they had some underlying condition that makes that common cold get worsened. But coronavirus, in a majority of the population, is causing severe form of infection. That is one. The second difference is that it spread way more faster than the general common cold. So we want to ensure that at least because of how infectious it is and the potential that it causes so much death, and we want to ensure that people are protected.
So you have told us that the virus has no treatment, has no cure. So when these people are admitted in the hospital and being treated for coronavirus, what exactly treatment are they getting?
Yeah, that's actually a very good question. In the scenario that you are in the hospital, that you are admitted, the biggest drug that is given to coronavirus patient is called oxygen, because we breathe oxygen, this oxygen that we breathe normally, but when coronavirus affects you, it actually attacks the lungs, and the lung is not able to support you in breathing as normally as it would otherwise be done. So you actually need oxygen. You need to be supported to breathe. And for you to be supported to breathe, to get the oxygen in, that is one of the biggest treatment that is usually being given. And the oxygens are given at different levels. There are some that you are just given some on the nose, putting some nostrils to be able to, nostril prongs to be able to ensure that you have that. Some are given using cannulas. So there are different ways in which they could be given oxygen. The amount of oxygen that you are given is actually dependent on the severity of the condition and how much oxygen level you have in your body. So the doctor will be able to measure and tell you that your body system is having this low oxygen. Usually you need to have at least more than 90% of the percent oxygen when it is measured. When it is low that, it means you need to be supported. When it's getting lower, even with this supplement, sometimes you may get into this thing that you hear, intubation. Intubation means now they have to put those tubes inside to support you to breathe, so that they can deliver oxygen directly into the lower part of your body. So that is the biggest thing. The rest is most of the time based on what we call it supportive management, which means what they find out. You have fever, you could be given fever drugs. Usually it could start just like by the simple things like the paracetamol to reduce your fever. The other thing that sometimes you have, if it's affecting your kidney, sometimes those people can be supported by using dialysis to try to ensure that the kidney is clean of toxins so that the kidney can be able to operate. And that supportive management is given to the different organ based on what the doctors find. So they will be doing different tests to figure out how your body systems, the different organs are functioning. But generally, it's supportive management using oxygen. You could be given antibiotic, and the reason rationale behind antibiotic is because most people who have viral infections tend to also have a superimposed bacterial infection.
Okay, one other one about the treatment. So what's your comment about using natural remedies like ginger and lemon and garlic, which people have used for the common cold, and also others say it is very good for coronavirus. Even Magufuli once said his son got coronavirus and just used ginger and lemon and he was okay. Yeah. So what's your comment about that in terms of treatment?
Generally, even before you have coronavirus, you need to have a well-balanced diet. A well-balanced diet means it needs to have fruits inside it. A majority of the fruits that we take, several of them are able to provide you with what we call antioxidant. It means it provides you, it boosts your immune system so that you are able to fight the virus, or you are able to fight any other disease. It's not specific to coronavirus. So taking a well-balanced diet, including the fruits, lemon is a good source of antioxidant. This one that tries to help you mop out the toxic things toxins in your systems. It can do, it supports that, but it's not used for treatment. It's used for the general support to ensure that at least you continue to have a much more better system. So I encourage everyone that nutrition is very important. You need to ensure that you have your well-balanced nutrition. You need to take lots of fluids. You need to take proteins, because proteins are able to give you the amount of amino acid that you need. You need to take lots of fruits as well, so that the fruits can also be able to give you the support your system so that you become strong in terms of immune response. So that's what I would say.
We have seen the restrictions that are being done by government, but we have also heard in some countries there is not so much restriction. Like in Tanzania, they go to church, they do everything, and we have not had a lot of deaths from there. What's your comment about these restrictions?
The coronavirus has different mechanisms of preventing it. We don't know exactly what is going on in Tanzania, and I won't actually, I won't tell you that I know what exactly is going on in Tanzania. What we are the message we are trying to pass here is that I think we need to encourage our governments to be more transparent so that they can be able to share as much information as is possible, so that if there's need for intervention, if there's need to be able to prevent one or two things, then we can be able to do that.
About the news that came out, I think through a video recently, and we've also heard it from other quarters, about some malaria drugs like hydroxychloroquine, which is supposedly to treat the virus. What's your comment, and why are we not using it on our patients?
Yeah. There are several drugs that that are currently being tried. Some of them you have mentioned zinc. There is azithromycin, there is azithromycin, there is the hydroxychloroquine, and there's many more drugs that are being tested. Most of those drugs have actually up to date. The evidence that we have is that they still they don't have evidence that they can actually be used in treating corona. So we are still testing more and more drugs, and the scientists out there are also continuing to test more and more drugs. But at the moment, none of those drugs can be said to be treating COVID-19. And that is the message even from the World Health Organization that we call WHO. As more and more of this evaluation continues, more and more of these drugs being used, being tested, I foresee probably in a year or so, that we'll start having some drugs that can be used to be able to treat COVID-19, including potential vaccines in the next year or 2 years, between 1 to 2 years from now. However, I want to finish that statement by saying supplements are generally supposed to, if you have something like zinc deficiency, zinc is supposed to help your body again boost your immune system. So generally that's why you need to get them from the foods that I said, a well-balanced diet. But there are some people that maybe they're deficient, so they're supplementing them also with zinc for the general body preparedness, so that your body has strong immune system. Even if you haven't had corona, then you are able to fight it. And most of these things you can easily find from the various food. And as I've mentioned, if you have some deficiency, or if you are recommended by your doctor that you need to take additional supplement, that will go a long way in supporting your body to be stronger to fight coronavirus.
Dr. Okello, for that presentation. That is quite informative. I believe our members have learned a lot, and should we have any more questions, we will be able to channel them to you, and we will channel the answers back to our members. Thank you very much, and thanks everyone for watching this program. Asante.
Thank you so much. Thank you for inviting me. Thanks. It's great having you, and it's great coming.